There are many occlusion concepts in the dentistry, but most of the dentists are confused with this concept. Could you briefly describe what is the COIS concept?
Okay.
Yeah.
So let me address that question a little different. I don't believe what I'm trying to teach is my concept. I'm trying to teach what the science is telling us, so that it actually has more to do with what is about the truth.
Yeah.
Now, one of the things I find so frustrating with the dentists that come to the center is when dentists are trying to do wonderful things for their patients and things go wrong, they have a lot of guilt. And the guilt takes the joy away from the practice of dentistry. When a restoration fails, many dentists feel maybe that failure is part my fault. I'm partly to blame. And this is why the teaching center has been driven to develop, number one, a risk assessment model, and number two, also aspects of occlusion that are fundamental in the longevity of restorative dentistry. Now, you asked about different concepts. So I'm going to mention two things that I think are very important. When we do single tooth dentistry, or for instance, even going to a course teaching implant occlusion, they don't really teach implant occlusion or occlusion at all. They teach risk management. Let me make it clearer what I mean. We all know when we practice single tooth dentistry on a daily basis, if you put in a restoration that slightly doesn't touch at all, I call it occlusion against AIR, air, means nothing, doesn't touch anything, our patients don't complain.
Yes.
Yet, when the restoration even touches slightly too much, we know there's going to be a problem. So what we've learned to do is err on the side of the restoration not touching. So we go to courses and people tell us a restoration, an implant restoration is an ankylosed tooth, therefore the occlusion should be light, or they should only be able to touch on it when they squeeze. That is not an occlusal concept. That is a risk management strategy. Because if you were going to restore an entire arch on implants, you can't do that. Something has to touch. So if we're going to truly understand how to restore either teeth or implants, we have to understand what people do with their teeth. And that is chew, speak, swallow, and breathe. That's what this system is meant to do. And when we understand the physiology of the system, it will be a lot clearer how to understand the occlusal aspects of the system. And then I'm going to mention one other thing. Unfortunately, I really believe that many occlusal concepts are flawed because they're not rooted in science. They're rooted in dogmatic concepts that were designed for occlusion that works on an articulator, not on a person. And to design an occlusion that actually chews in the mouth is a very different way to understand how to design the way teeth fit together. And that's what I hope to do when I come for my lecture. I'm so excited to be able to provide you a concept that works not from the inside out, right working, left working, or protrusive. Those are not physiologic concepts. This system works from the outside in. You have to eat, you have to chew. It works from the open position to the closed position. So really what occlusion is really about is how does the brain find where the teeth fit together? And that's what I'll be describing to help people understand that when you restore someone, they have to relearn how to chew. They have to relearn how to speak. They have to really realize what this system is now designed to do, and therefore we do have to pay attention to important details so that the patient can adjust or adapt as quickly and seamlessly as possible so we don't have problems.